Same with any viscous solutions to prevent poor surface wettability.
We have so many different management strategy for wettability issues. We will see them.
So this is a patient of mine who had, you have those patients who everything has happened with them. And I think she was the first patient who broke her scleral lens. I was like, wow, that's amazing. She put 2 scleral lenses on one eye one time, but this is how she came in one day with the surface of her lens. But fortunately, we've gotten that under control. So yeah, the question is, what do we do? And I think managing the ocular surface and treating the meibomian gland dysfunction and Demodex blepharitis in general, to your maximal level. So whatever you think is the most that you're going to do, go ahead and do that for your scleral lens wearers, especially those who have surface wettability issues.
I would like to add something. Okay, so here we know that mucins and lipids are attracted to the hydrophobic oxygen permeable scleral lens material, forming deposit and resulting in poor wettability. So selecting a material with a low wetting angle, even if often it means a lower TK, can help improve the wettability of the lens and reduce the hydrophobic areas that attract deposits. And also it's important to aggressively treat the patient's ocular surface diseases before fitting scleral lenses. And despite changing the lens design and material, the surface of the lens itself may remain compromised if the condition is not appropriately managed.
Oftentimes in severe ocular surface disease with systemic flares, which can be chronic, such as in Sjogren's syndrome, these issues are chronic. And so I ask my patients, are you having a flare? Like, how are you doing systemically? And I have some really challenging cases where they have chronic systemic flares that are affecting the ocular surface and the ocular surface of their scleral lenses.
So here, patient education is crucial. Hygiene and hand washing are imperative. Research has shown that post-lens tear debris consist of high concentration of lipids. Unsurprisingly, lens surface and tear reservoir fogging issues are common in patients with ocular surface diseases. So check the soap used, avoid deodorant, scented, or moisturizing liquid soap. And you can recommend clear hand soaps, mild basing head soaps, those specific for contact lenses or those indicated for treatment of acne.
A new solution in the US, at least, which is a hypochloric acid spray for the hands, specifically for contact lenses. It's called Vibrant View, and it's the image there on the bottom left.
Okay. So do not apply makeup or oil-based moisturizer to the eyelids. Oils can spread along the skin and contaminate the tear film. You can use makeups that are not oil-based. Isopropanol-based extra-strength daily cleaners are especially good at removing oils and makeup from soft and rigid lenses.
And just really important too, it's important to put contact lenses on first and scleral lenses, and then apply face creams and makeups, and then in the evening, removing contact lenses and then washing the face. And just that simple act is important so that we don't get debris on the lens or in the lens.
Okay, so lid hygiene is crucial for managing lens poor wettability. There are several products for lid hygiene. This is a list, maybe more from US products than other countries. Do you want to add something here, Melissa?
Oh, yes, this is an exciting time in eyelid hygiene. So this article came out a few years ago, and there are a few new products that are coming that I'm really excited about in the next 1 to 2 years for the eyelids that are going to be really helpful. But I'd say the most important thing is to have some sort of recommendation for your patients. The studies show that baby shampoo really doesn't work. That's not a recommendation, nor are just warm washcloths in general. So recommending some sort of commercial eyelid cleaner, some sort of compress that is helpful. But there are lots of really great products out there currently, and very exciting ones coming in the near future. So it's also important to review solutions at every single visit, going over the application solutions and disinfecting solutions, not using anything abrasive like that would have silica in it, like in toothpaste, that would damage the ocular surface. We've had a lot of problems lately in the US about solutions being on back order and then coming back and then being discontinued. So this Loba, our Optimum extra strength cleaner, is pretty much gone now. It's not available at this time. MirrorFlow was gone, but now it's back, which is an alcohol-based cleaner. But Daddi, are you having the same situation where you are, where solutions are getting hard to find?
No, fortunately in Italy we don't have this issue. We all have the solution. Actually, Boston has finished providing the solution because they are renewing the formula of their liquid, so the solution. So we are waiting for the new formulas of Boston solutions. For other solution, we don't have any problem.
Oh, that's great.
I would like to add something here. So digital rub and rinse is necessary for good comfort and vision. Inadequate surface cleaning surface causes irregular hydrophobic surfaces that may create a debris attachment cycle. I would not use Boston Advance. I would prefer using Simplus. If the patient is already using Simplus, try Clear Care, or for European or other countries has another name. So
is it still AOSEPT or is it something different?
Yeah, the name is different. The solution is the same, but the name is
different.
Yeah. So traditional GP contact lenses, the disinfection solution are thick and viscous, which may result in chamber debris and cause fogging on lens surfaces. So instruct patients who use such solution to rinse the inside bowl of the lens adequately with saline prior to application, and also cleaning the lens with Project once a week or bi-weekly, depending on the ocular surface, can loosen and remove the surface protein deposit, bacteria, fungus, and all the deposits on both surfaces after a 30-minute soak without manual rubbing.
So Menacom ProGen is really effective. It works extremely well. However, if the lens surface has tangible hydropeg, it will strip. Menacom ProGen will strip the hydropeg. And so if you don't want hydropeg, then you can use it. But if a lens is not hydropeg treated, then Menacom ProGen is really helpful.
Okay, you can also suggest the use of lubrication with preservative-free artificial tears over the lens throughout the day. You can also suggest to remove the lens, clean it, and reapply it, or polish the lens, but carefully, because polishing the lens, that would remove surface treatment, as you already said, Melissa. Well, here, interesting that what patients can do while wearing the lenses to avoid removing the lenses, especially in these times where hygiene is very important to avoid the exposure to the virus, is to wipe the anterior surface of the Scleral lens when it's applied on the eye with a moistened cotton swab or Scleral lens plunger. You have to place drops of lubricant in the eye or on the device and rub the surface of the Scleral lens with the device.
And this is also really helpful when we're fitting diagnostic lenses and the lens surface is just completely has poor surface wettability and you're seeing all sorts of debris. I tend to use a plunger in the office, wetting it. And I tell the patients, I'm actually going to use this on your eye because it's pretty strange, and just clean that up to get an over-refraction when fitting a lens. So it's a really helpful hint, because when we're fitting lenses, we want the lenses to settle onto the scleral conjunctiva, and it would be a pain to take it out, put it back in, let it settle again. So you can use just a quick on-eye surface cleaning. And Daddi, the interesting thing, I tend to do it horizontally. I see here you're doing it vertically with the plunger. You could do it either way. Either way is fine.
This is a great point, Melissa. I don't know if you had experienced this, but we have, apart the diagnostic lenses we have in the office, I have the experience that when I order the lens and the lens is new from the lab, the first time that the patient fit the lens, the wettability is not optimal. So removing the lens and re-putting it on the eye will worsen the wettability. And this is what I do also in my office with a plunger. I clean the lens without removing it because it will worsen that.
So when you get new lenses, for those of you new to scleral lenses, give it a good rub before you're fitting it. I mean, disinfect it, rub with solution prior to actually using the lens is going to help with the wettability. So here you can see really poor surface wettability on the left, nice wettability there on the right, and this is thanks to Tangible HydraPeg, which is a surface treatment that helps improve wettability. It reduces deposits on the surface of the lens, it improves lubricity, and it helps with scleral